So I rushed outside really quick so I could make sure I attend. My name is Christina Miner. I am based out of Prince George, Virginia. And I'm so thankful to be here again another year with you all and be able to share everything that I've gone through. And if anybody has any questions, I'll try to help them as much as possible. Do you want me to just talk about what? Okay.
Tell your story.
So basically, in 20, actually, when
But
I'm 40. I'm
please
sorry, go ahead.
start with your name and what you represent.
Okay, so my name is Christina Miner, and I represent Our Scars Speak, which is a podcast that I have that is geared towards breast cancer survivors, thrivers, anybody in the breast cancer community, even caregivers, mental health and medical professionals. And they come on to share, like if they're a professional, what they're doing within the community and give us some knowledge. And if they're a caregiver or even a patient, or if they're a survivor or thriver, they come on and they share their story about before breast cancer, during, and now. And the reason why that's significant is because a lot of times people want to hear our story from the point of cancer when we've actually, had life prior to cancer. So I really want to make sure that's captured every time I do an interview. Also, we like to make for sure that the caregivers have a story and, they can share their story, because it's about not only our physical scars, but our mental and physical scars speak a story that can help heal the wound of another. So that's the whole concept of Our Scars Speak. So outside of that, I also help another organization called Here for the Girls, which is a nonprofit organization for women 51 or younger who've been diagnosed. So that's a lot. And also, of course, male breast cancer happens. I can't forget about you all. I help whenever I can with Brett and Peggy and just getting the word out about their organization and linking people up to other organizations, because it takes all of us to conquer this disease. Outside of that, I was diagnosed myself at the age of 44. However, it took almost 20 years to even be diagnosed. And it was a rough 20 years because I had all the symptoms pretty much. Like I had the inverted nipples, I had some discharge, I had pain, I had itching, I had pulsating veins, I had, what else did I have? Oh, the breast began to become enlarged. It was my left side. And I kept on complaining. And they did a mammogram when I was in my 20s. I probably was about 26. They did a mammogram. They didn't see anything, but they told me I did have some dense tissue and to be aware of that because things could hide. So years passed on, symptoms continued. I continued to complain. And I'm not going to say it necessarily fell on deaf ears, but sometimes I feel like it did. And so they kept on doing mammograms. I had maybe two before the age of 40, and they kept on saying they couldn't find anything. Yet I still had breast dense tissue. 2015, it was severe pain, and it was just the pulsating vein was protruding even more, and it was hot to touch. And so the doctor said you need a mammogram and an ultrasound. But in 2015, the radiologist denied me of my ultrasound. He said that I did not need it, but if I continued to have pain, to come back. And I did, and he still denied me. 2020 went back because now I'm finding lumps, like literally lumps in my hand. And I went to the doctor, and that is when they discovered a calcification. And they said, oh, it's the same one that matched the one from 2015. And I was like, I was never told about a calcification. I got a note in the mail that said that I had dense tissue, but everything was fine. Come back in a year. And they said, no, you had calcifications. But when I pulled his report from 2015, he stated calcifications, and he stated I probably should come back in 3 months. I was never told any of that information. So I always tell people it's significant to pull not only the information they give us through the mail, but pull your actual records, pull the notes, pull the imaging, and read all of that. And if you can't understand it, get an advocate or get your doctor to explain it to you. So 2020, that's when I found out I had a biopsy done. They said it was benign, had mammograms, ultrasounds, everything is benign. They still see the lumps, and they see an area that's a shadow area and the calcifications. And they said the calcifications may be cancerous, but they weren't sure. And I said, well, what are we going to do about it? And they said, well, we couldn't reach one of the areas that looked like a shadow or a ligament. And I said, okay, well, let's go back in. And I was told by that radiologist, you don't want me to continue to cut on you, do you? And I was like, have you been through this? And she was like, no. I said, well, don't tell me what I want for me. So my doctor ended up, I spoke with my surgeon and she said, you know what, come back in 2 months. In 2 months, the areas had already grown and they did another set of biopsies. And when they did those biopsies, it came back to be ductal carcinoma in situ, which is stage 0, ERPR positive, HER2 negative, but then also it was a grade 3. So it was growing very, very fast. So my doctor told me she was glad that I advocated for myself because had I not, this could have been a different situation. Then they say, oh, okay, you can do a lumpectomy and, radiation, tamoxifen. And I said, well, my husband asked the question, what's the best way far as recurrence where it wouldn't come back? And they said, well, 2% chance of not coming back if you do a double mastectomy. And I said, yeah, go ahead, take both because the right side is feeling like the left one did when I was in my 20s. So she's like, well, it really isn't that bad. I said, no, take them. So when I woke up, she said, I'm glad. And I got the pathology report. She said, I'm glad you took it. She said, because that breast was in fact changing as well. And you would have been back in here within 6 months to a year. So I'm glad that for me, I pray and ask God and just follow him. And he directed me to do that. So I did that and I was thinking, okay, I'm going to do, I'm going to go ahead and get reconstruction, what everybody, a lot of people do. And I did the expanders. Now, mind you, COVID was going on. So I got the expanders and they start literally feeling like they were popping out of my chest. I was having such a bad reaction. Unbeknown to me, I had never heard of it. I had breast implant illness and I had what's called capsular contracture, where the scar tissue was like overgrowing and pushing the foreign object out of my chest, literally. I was her first surgery. And she said, what do you want to do? Do you want to go flat or do you want to, what do you want to do? And I said, well, I don't know. I'm trusting you and God because I didn't even expect any of this to happen to me. I woke up, I was flat. She said, you were damaged severely. We tried when I cut you open, it literally busted everywhere and went all over the OR assistant. And she said you were severely damaged from the expander. You had a bad reaction to it. The capsular contractor was definitely pushing it out of your chest. And she said, I will not put anything related to implant in your body ever again. She said, but you can come back in about a year. She said, give yourself at least a year to heal, and then we can talk about other things. But I decided to just stay flat and embrace that. So that's something else that I'm very passionate about, is making sure that patients have a choice in their treatment plans and making for sure that we're our best advocate. And if we choose to be flat, that's our right, not anyone else's right. No one should ever tell a patient, oh, no, you need to have implants, you'll feel better. That's not necessarily true. It's our bodies and our right. So, yep. So that's what I stand for. I stand for choices, our choices for our treatment plans. And how you doing? Our choices for our treatment plans and for us to just be an advocate for ourselves. And if not, then make for sure we talk to other people that can help us advocate for ourselves. And that's why it's important to make for sure, even for men, because I've had actually a couple of men that I've helped, Peggy, that I've helped. And if you come to Peggy and I'm like, hey, Peggy, look, this guy has da 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 going on. And she's like, oh my gosh. And she tells me, and she even tries to link me. That's why it's so good to have a network. And a matter of fact, that gentleman is going for a biopsy. And I'm very proud of that because that's teamwork to help someone who did not know anything about cancer or lumps or anything. It's not saying we know everything, but we can help people get that information, and it's significant and it's vital.
Very much so.
And Christina,
where do you work every day?
I work at the VA hospital.
Thank you. That's what I wanted to get
Yeah,
at.
the Veterans Hospital in Richmond.
Christina, I was just going to say, I was a caregiver for my niece. She had metastatic stage. It started at stage 2, 2.5, and it progressed so fast and so quick. I mean, literally. But I wasn't her main caregiver, but I was part, because she was like a sister to me. And what happened was, if it hadn't been for Sherry walking me through, because I'm a fixer and I couldn't fix anything for her.
Right.
I couldn't make her better other than the shirt and the stuff that Sherry shared with me. So that caregiver role is a lot
Yes.
harder than people think, because it's not like the flu or even pneumonia. You can fix that, but you can't fix this,
That's
unless
right.
you just have to have support. So thank you for that. And I really think that's critically important. It
It
was so
really
important to
is.
me.
It really is. And the reason why I was a caregiver for my sister for over a year. It wasn't cancer, but she had liver failure and she had to get a transplant. And so with that being said, they gave her 3 months to live. Thank God she's still here with us today. But that year was very, very sorry about the train. That year was very, very intense. And I realized even the more the significance of a
Yes,
caregiver and what we
exactly.
go through. And I always tell people, like, a caregiver, especially if it's a parent or, a significant other, or sister, you want to protect with everything you have. But like you stated, you can't with this. It's an invisible disease. You don't know when it's going to end or if it's going to end or how it's going to end. So being there for them mentally is so important, but also making sure you have, as a caregiver, the support that you need as you go through as well.
And being that advocate. My husband's
Yes.
been sick for 5 years, and I've been the advocate, because you have to have somebody else to
Hmm.
be there for you, to represent you, to make sure that the right decisions are made. That's so important.
Absolutely.
Thank you for sharing that piece. That's so
Yes,
important.
it is. And the day that my first appointment after I found out, I had my mom, I had my husband, and I had my sister with me. And it was interesting because our roles changed at that point because I was her caregiver first, and then now she became mine.
Mhm.
The more the
Wow.
merrier. Yep.
Absolutely.
Yep. So yeah, so those are the things that I do. That's my story. I have been in the Women's Health magazine. I had an article done on me about being flat. I don't know if you all are familiar with Healthline. It's a platform as well. And they also they have an extension called Bezzy, Bezzzy, and they're getting ready to do a feature of my story as well soon.
Awesome.
And they're looking for other stories as well.
Wonderful. Ron, you got a
So,
question there? Go for it. I don't know if he was gonna, nope, maybe not.
oh,
I couldn't tell if it was him or something.
so yeah.
Wait,
So,
Ron's muted. Maybe it was.
oh,
Hold on.
okay.
He got down mute. I asked to unmute. There you go.
Oh,
Perfect. Christina, I might have met you along the way. I think we might,
Yes, you
yes.
have.
Yes.
because I have a podcast as well. And I don't know, I don't remember that it might have been a couple of years ago. But anyway, I know of your podcast.
Mm-hmm.
Uh, my question for you is, when you were getting all these let's call it resistance
Mm-hmm.
from the hospital personnel,
Right.
uh was this all contained in one venue, or did you reach out to other facilities for a different opinion?
So what happened in those situations? So some of it was, some of it wasn't. Starting out, it was individuals that I really trusted because I worked with them in the hospital. And so it was a doctor, he was a surgeon, and he explained about density, he explained everything. Um, Nevertheless, back then, of course, early 2000s, they weren't doing the ultrasound as much for density. So he just explained it and was like, you look fine. Later on, it was pretty much out of the same facility. However, when I had my imaging, it was out of a different facility. So it was kind of like different, connected, but not connected at the same time. And I know I've had a lot of people to say, did you feel like there was some discrimination or something within that? Or, did you go get a second opinion? And at the time, I didn't know enough. Like, I worked in the hospital, I've worked in different, departments, never worked with cancer though. too much, just primarily other, like ER and CC cardiac care units. So I didn't have that intellect of, oh, shucks, maybe I should, because I was taking their word for it after all these images. I was like, oh, okay, they should be able to see something. And I kind of took it for face value. I will say the words, you're too young, and a lot of I do remember hearing these two statements. You're young, and a lot of African American women don't have breast cancer at this, during that time period, let's say that was told to me. You're African American and you're young. So 9 times out of 10, it's nothing to worry about. It's probably just fibrocystic tissue.
Yeah. Just curious though, when
Mhm.
you were going through that and you were hearing this, what was your gut telling you?
My gut was telling me, honestly, something is wrong.
Okay.
I didn't necessarily label it as cancer, but
Right.
I knew something was wrong. And then right before, I think 2015, around 2015, I had a conversation with the woman, and she was like, you need to stay up on it, because it was 2 women who had breast cancer themselves. 2020, when it really started getting worse, another lady, I went to actually one of Dr. Love, I think that was her name. I went to one of her conferences, and she was talking about how so many women, especially African American women, are ignored about pain and ignored about certain symptoms. And especially then about women being, the thing is, oh, you're too young for all races, And I was like, oh, this is a problem. Like I was like, I didn't realize it until that conference and some friends telling me you have to go back and push. And that's when I found the lump, though. So it was like, I'm not budging. So when that radiologist told me, hey, look, you don't want to keep on getting cut on and this, and I was like, no, I am not. And she was like, 6 months. I was like, I will not come back in 6 months. You're going to see me in 3 at least. And that's when the doctor intervened, and she said, come back in 2 months. And she was glad that I didn't, because it could have been worse, because it was a grade 3.
Yeah. It's always interesting to me how when you stick to your guns
Mm-hmm.
down the road, then the doctor comes up with the saying, "Oh yeah, I'm glad you did that."
Right.
Like where were you like 6 months ago?
Right.
Yeah.
Right.
So
Yeah.
I think
Yeah.
the bottom line is for people out there listening to this is if your gut tells you something's not right, go with your gut and just get another opinion.
You have to. And just like, it was hard when I even getting diagnosed with the breast implant illness. I didn't know, I had never heard of it. I never knew even what these symptoms, I could even look up to see what it correlated with. Like I did my research and I was just like, what is going on? And she came to me and she said, this is what you have. So I went back home and researched it. And I was like, oh, doctors are saying it's a mental thing, And she's like, no, she was like, it's not mental. I believe my patients, and your body reacted to these implants, well, expanders, but same material. And I went with my gut with that, even, like I knew something was wrong. And then I started being able to physically see it literally trying to come out my chest. And that's when I was like, but during that time, COVID was going on. So they were not opening the doors for surgery.
Yeah.
And my doctor was like, I'm trying so hard, but they keep on pushing back saying it's a cosmetic surgery. And I was like, I didn't ask for cancer. That's not cosmetic. It's just, so I had to wait. And then I got scared because one of my friends, her implant actually came out in the bathroom floor. And then they were ready to say, oh, it's not, it's emergency surgery now. And I was like, I don't want it to have to get to that point, because then I'm looking at potential infections.
Yeah.
Yeah.
So it was rough. It was
Oh,
rough.
it's amazing. And
Yeah.
and that's it. In your own gut, and we've said it many times today,
Mm-hmm.
you're the only one who lives in your body.
Yeah.
If you think something wrong, guess what? Most likely it is.
It is something wrong.
And
Absolutely.
I love all of our doctors and medical professionals, but they are human beings too.
Right.
They can
Right.
only practice medicine to what they know.
That's true.
And there's nothing wrong with getting another second, third, fourth, fifth opinion.
Right.
Because if they've
So
never
sorry.
treated it, They may not know how to treat it. Okay. And that's all right. We're all human beings and we love every one of us because as a team, we couldn't get things done if you don't experience it. And it's through our experiences that we're able to make all the changes out here, guys. And that's what we're
Yeah,
doing here today to all the patients, to the professionals.
right.
That's what's helping to make changes. So
Yeah, and I thank goodness for my surgeon. She's always like, okay, if you got any hip pain, if you have any pain, come back. And she's quick to do a scan or whatever I need done, to ensure that the cancer hasn't come back.
absolutely. And
And
that's wonderful.
she'll tell me quick. If you don't believe me, you go see another doctor and get a second opinion. So she really is, she'll tell you quick to do that.
Hey, Christina, is it possible you can put your contact information in the chat?
Yeah, Ron, I'm going to connect everybody through an
Sure.
email, but yeah, put it in there too if you get, or you're on your phone, right? So,
Yeah, but I can do this.
No, tell me what. Just say it, and I'll type it and put it in there.
Yeah, Brett.
yeah, Brett.
Oh, I think I already did it. So
Okay.
if you look at my name, you'll pretty much find me. You'll see the article,
Right there.
and then Our Scars Speak. You'll see the podcast, the Instagram.
And how you can reach her. She's amazing.
So
Helen, making good out of bad. Let's put
that's
it that
right.
way.
Absolutely, absolutely. Got to. We have to. It's lives that depend on it.
Oh.
Our own lives and other people. So
Yeah, and other family members. And Christina, you haven't been on, but you need to at the holiday parties coming up and families all together.
Okay.
They were just on Rutgers.
oh
They're doing
yes,
the saliva test. It's free. We need you to
Yes.
sit for it. I'll be sending you information. They have to get all ethnic groups involved in this.
oh wow.
And
Okay.
genetically, it's hopefully going to find out more mutations that are causing
Mhm.
all different cancers. And Dr. Tara was on and Dr. Stephen, and this will be amazing. And I already
Yeah.
did it. They send it to you free of charge with a return mailing pouch that's paid for. And you're doing the saliva, you ask a few questions.
Right.
We have got to get it out everywhere, especially African Americans, because they need this to have their clinical trial and research to be full.
Yeah,
Yeah.
I passed that out to my family already. I was like, y'all got to get this done, because when mine came back that I didn't have a mutation,
Yes.
then if it would have came back that I did, then everybody could have got tested. But
Right.
because I didn't, they didn't get tested. So when I seen that on y'all's web, I was like, oh my God, y'all have got to go here.
And
they were
that's
like, "Who
why
is
they're
this?"
making the change, because this is why so many other cancers are going unnoticed,
Right.
because they don't know. And
Yep.
they need, and you'll get to see it because all the recordings of everything today will be soon up on the YouTube. I will be sharing it back out. It'll be on the page that you guys are on, but your video will
Okay.
be there too. But you need to get this out to
Mhm.
family members during the holidays and get them to get it out to their friends and their family members,
Yep.
because this is what's going to help change treatments,
It will.
cancer, genetics, everything.
It
And
really will.
if it doesn't start and continue with us, they can't get the study done. And
That's
this
right.
study will make the difference, guys.
That's
It's going
right.
to. So
It really will.
God bless you, kiddo. We'll let
Thank
you get back to work.
Yeah, I got to
But
get back
thank
to
you
work.
for taking time.
I
wait,
have a
Tommy
quick
has a
question.
Yeah, sure.
How you said you work with the VA, right?
Yes.
Oh, he's VA. That's right.
I've brought the information to all my doctors at the VA here in Las Vegas,
Mhm.
and it's the information. I know 12 veterans in the Las Vegas Valley that had breast cancer, and they are a lot of them were Marines, and they're like
Oh.
Camp Pendleton.
Yeah,
They don't want to
Pendleton,
talk.
Virginia.
I'm like, how can we get the VA to get this information out there more? Because when I was diagnosed, until I found Peggy, you can ask Peggy, I was running around like a chicken with my head cut off. I had
Yeah.
no idea what to do,
Right.
and there was nothing.
Well,
So
I
how
will
can
definitely present it. I know some people I'm connected to someone who started a women's group here. So, because I don't even think they had that. So I can definitely reach out to her and the chaplain that's over that and start there and see if I can get some information, if they'll allow me to put some information in here. So yes, I
Okay.
will do
Okay.
my best on my end.
And
I'll shoot you an email
Yes,
and
please.
you'll respond. Okay, cool.
yeah,
that'll
yeah,
be great.
Tommy, it's our Scar Speaks. Just go to her page and her Facebook page.
Yep.
It's amazing.
Yep, and just send it to me. I'm sorry about all the beeping. I thought I came on the quiet side of the hospital, but obviously I have not.
You're doing good, kiddo. But thank
But
you, thank you.
thank
The
you
Thanks
so
so
knowledge
much.
is
You're
fantastic.
awesome.
All right, thank you.
Take care. Thank
All
you.
right,
We
bye-bye.
appreciate you.
Bye.
All right,
Bye.
bye-bye.